US healthcare policy challenge. How can the US provide access to affordable health insurance for all Americans? How we are meeting the challenge? Assessing the impact of changes to the Affordable Care Act, estimating the cost and coverage effects of supplementing the current system with a single option or Medicare buy-in plan or replacing with a single payer alternative, understanding and contributing to policies for improving quality and access in the Medicare program, the largest US health care insurer. The COVID-19 pandemic has exposed in the US health insurance system, in particular the risks of linking health insurance to employment. According to the Kaiser Family Foundation, as many as 27 million Americans who lost their jobs also lost their employer coverage. The development points to the need for strengthening safely net option for Americans to get coverage elsewhere as well. Rand experts have commented on how COVID-19 is affecting the healthcare system and how to strengthen coverage options and the system writ large in a post-COVID-19 health landscape. The ACA's individual market exchanges are the main alternative to employer coverage for adults under 65, yet the further of the ACA is uncertain. The US Supreme Court is set to rule on the ACA's constitutionally. Rand experts suggest that if the court strikes down the law and millions of Americans lost insurance during a pandemic, the rate of coronavirus transmission could rise and the already heavy burden on hospitals and doctors could increase. Using Rand's compare microstimulation model, Rand analysts have also estimated the effects of refinements to the ACA, such as adding a public option alternative models such as single payers. The future of US healthcare replace or revise the Affordable Care Act. The Affordable Care Act ACA in US healthcare landscape, the law's goals were to reduce the number of uninsured, make coverage more affordable, and expand access to care. To accomplish this, the law expanded eligibility for Medicaid and created new marketplace where people would without employer coverage could buy policies directly from insurer. It uses a carrot and stick approach to promote enrollment. Most adults are required to have health coverage or pay a fine, and moderate income individuals receive premium subsidies to buy policies in the new marketplace. Since the ACA's adoption, an estimated 20 million people have become newly insured and approximately 24 million people have gained access to subsidized or free care through marketplace tax credits and Medicaid expansion. Despite these successes, the law faced strong political headwinds from the outside. There have repeated calls from both sides of the political spectrum and repeal the law and replace it with alternative reform or to modify the law to address other goals. Rand research offer Insights about the likely impact of repealing and revising the ACA RAND's research on ACA makes use of an updated version of RAND Compare.